Childbirth is one of those experiences that is so intense for some women that it can cause their brains to block it out and forget about it. I think it's also an evolutionary thing because if you remember traumatic incidents, chances are you will not do it again. But there's one thing that can happen during childbirth and delivery that is even more dramatic than giving birth to the baby itself, and it's something known as an episiotomy. An episiotomy is a small surgical cut that the doctor or the midwife makes at the opening of the vagina during childbirth to help widen the birth canal. This is done especially when the baby is in distress or when the baby is taking longer than expected to come, or if there is the risk for some other serious uncontrolled tearing. Episiotomies aren't as common as they used to be, especially in hospital births, because doctors are more likely to do an emergency C-section if any problems arise. But you'll still see them happen a lot more with home births. Talking about home births, those don't seem to be as common anymore. I don't know if it's just me. Now, if you do end up with an episiotomy, proper care afterward is super important for healing and to avoid infection. So here are a few things you can do to just make sure that you better take care of yourself post-episiotomy. The first thing you want to do is keep it clean. After using the bathroom, rinse with warm water and use a peri bottle if you're trying to avoid discomfort with wiping. Stay away from any harsh soaps or perfumes as they can irritate the area. You also want to be able to use cold compress. Cold compresses on your vagina or in pads will offer a lot of relief. You may also be prescribed pain relievers like ibuprofen or stronger. So just make sure that you're following your dosage instructions and the advice of your healthcare team. You also want to avoid sitting on hard surfaces or sitting down on your butt area for too long. So you may need to get a special pillow just to make sure that you're not sitting on that area for too long. Avoid any sort of straining, so don't lift heavy. You will obviously not engage in any sexual intercourse until you are fully healed and cleared. Something that I see a lot of women doing is steaming. You do not want to do that. You do not want to sit on any sort of hot or steamy baths when you get an episiotomy, because this just provides really good breeding ground for bacteria. You also want to wear comfortable clothes, so any sort of loose fitting cotton underwear is your best friend. Episiotomies are painful and nobody really plans to have one, but if that's something that happens to you, really work with your doctor to make sure that you don't get any sort of an infection, because that's usually where the problem lies. Stay healthy.